We just lost you due to a Wi-Fi issue, but we changed you over to cellular data. So I hope that you stay with us. Sorry if you guys had just seen some of the video. Here it is. Now, L-Arginine is an amino acid that is involved in nitric oxide production, among other things. It's a direct precursor to nitric oxide. Nitric oxide opens up blood vessels, promoting vasodilation and the delivery of blood and oxygen and nutrients to the entire body. Now, this is also important during pregnancy to deliver ample amounts of blood and hence oxygen nutrients to the fetus. It's not just arginine that's a player here, it's also L-citrulline, which is in the same pathway, a precursor to arginine, and anything that would pretty much boost nitric oxide. We'll give a list of foods here at the end. Now, during pregnancy, the demand for arginine is increased with placental and embryonic needs. And so, in a place of low socioeconomic status, a low resource area, people typically need more L-arginine through supplementation. They're not getting enough from the diet, and this could be due to the fact they're just not having enough protein. Foods that are high in arginine, like lean meats, like organ meats, like eggs, like fish and nuts and seeds and things of that nature, right? And this is gonna, well, I should say first, it could be that, or it could be reduced endogenous production because of things like infections even. So I don't want you to think it's all just from the diet. It could be reduce of endogenous production of L-citrulline, the precursor to L-arginine, because of infections. Most commonly it's malaria in these places of low socioeconomic status. Right? And so, interestingly, it has been shown that even in high resource communities, L-arginine supplementation helps to increase the length of time of gestation that the child is in the womb, of pregnancy, reducing the risk for it being born preterm, increases their birth weight, also reduces the risk for developing preeclampsia. That's hypertension, or high blood pressure, proteinuria, protein in the urine, and edema, the buildup of fluid, something that can come on anywhere from 20 weeks into pregnancy, through the end of pregnancy, up to, into the week after you're pregnant type thing. And it can develop into eclampsia, and that could be something where you have seizures, and that's no good, right? So obviously we want to avoid that. So it helps to lower blood pressure, right? Because it's opening the blood vessels. So that's another good thing. It's not just a delivery of oxygen and nutrition to the fetus, but it's also good for the mother. It improves hemodynamics in both the mother and the fetus, right? And so what are some foods that naturally boost nitric oxide in general? We just said a few that would boost arginine. Surprise, surprise, meat was on there. Organ meats. They have so much good stuff in them. Well, also things like leafy greens. Now, they have nitrates. That'll boost nitric oxide. Watermelon is rich in L-citrulline, and that's a precursor to arginine. Look into supplementation with citrulline as well. The article I was reading was really heralding L-arginine for these purposes of improving the hemodynamics in maternal and fetal hemodynamics. But fancy way of just saying blood flow and delivery of oxygen, nutrients, and stuff like that. Look into L-citrulline as well. It is a precursor to L-arginine. It has a lower first-pass metabolism. Less of it gets degraded before it has a chance to reach tissues and have an effect. And it doesn't promote the production of arginase enzyme in the liver. That's an enzyme that breaks down L-arginine. Promotes the production in the intestines and stomach of arginase. Right? So, that seems like L-citrulline is a better option for boosting nitric oxide in itself. I did not look at studies containing citrulline for this purpose, so I can't speak on that today, but I would have a hunch that it would maybe even be a better option. I would talk to your doctor before taking anything, right? And I would just get foods that are higher than both, first and foremost. So again, we have leafy greens, we have citrulline, we have dark chocolate, pomegranate, citrus fruits, watermelon, meat, garlic. These would all be things that boost levels of nitric oxide. They're some of the major boosters of nitric oxide. And so look into each one of them and see, I believe they all are good to have in your state of pregnancy, and especially depending on anything else that you're taking. Hopefully it isn't much, except for formulas, things that will provide a lot of nutrition. Get as much as you can from the diet. And that's another interesting reason to eat some of those foods and to maybe consider L-arginine supplementation, especially if you're in a low resource community. and you're not getting enough protein from the diet, and hence potentially not getting enough arginine and improving blood flow enough for that baby to grow big and strong and be happy and healthy, just like mama will be as well during pregnancy if she has plenty of it. Who do we got on here? Very interesting topic today, I thought. If any of you are pregnant, hope that helped. Jake, what's up? Keely, Nels, Steph Apple Blue, Mano Salva, Selmac, Cheeky Case, first one of the day. Thank you for coming on, my friend. This one is for you. And I hope you guys have an absolutely fantastic rest of your day. It's all we got for you folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have a great day. It's a beautiful Saturday. Enjoy it. A little chilly before, but now it's a lot better. And happy wellness. We'll see you guys tomorrow. Thanks.